spot here. It's the best we could do. Sorry, I was like already on the road.
Did you get a car?
What, my sister got me.
Oh, okay.
It's fine. Yeah.
We're gonna need to let him in here too.
Guess who?
Mike, how are you?
Mark, I was thinking maybe we could have him come down through here so he doesn't have to try to meander through the,
We're the only ones? No more baggers then.
Where'd he go?
Sure. I mean, I'm just trying to say, when Mark gets here, here versus trying to trip over the
Just a
cameras.
lot. On disabilities, I think there's.
Is it making any difference?
I,
Like last time?
the difference versus getting knocked over mid.
Is
anybody gonna come through?
Just leave that wrapped over.
Yeah, we'll just leave this like that.
So my
I
dad
can move
hit
it
my
once.
car.
Okay.
I was supposed to be ready today.
Object.
And they said it'll be ready tomorrow because they had to paint some part.
There's no live mics.
So is the sound working for him? Yes.
It's good, yeah.
Okay.
You're all good.
What's up?
Live stream.
Nothing wrong?
Oh, you do?
Yeah.
What's the more open? Maybe I do have mine.
Yeah.
Oh, no, yeah, there's an hour.
Where were
Charge
you
it.
with,
Thank you, bud. Appreciate it.
what's up?
But,
Oh my gosh.
Arthur and,
that's not a bad idea.
Oh, okay.
Get that situation?
Just make sure that it's working.
Do you guys want me to move some chairs in front of the camera so some of the reporters can sit?
you
guys good?
so fast.
Are you guys good?
It doesn't matter. Just want to make sure it's.
It's fine.
That's fine? Okay.
Good.
It is.
It's going?
Yeah.
Can you ever find an outlet? Is that an iPhone?
Yeah.
Instead of like.
Oh, you do?
If you can find an outlet.
President Sears.
Oh, yeah, I think I see one down there. I'm Liz, by the way. Casey, thank you so much.
I haven't repaid it.
Appreciate it.
Did the Red Sox one? Oh, no, they're not. They're 136. Password.
Thank you, Mike.
Oh, no, seriously. I have like all the chargers, one for thing, and they still die.
I used one of my buddies to throw those one day and I was like, dude,
And it,
whatever, just charge my phone halfway in
You
20
need to get-
minutes.
you need to
I
get
did,
one?
yeah.
okay, then on it. I'm on the end then.
Okay.
Do you guys need another audio test? Or are we good?
Yeah, that'd be great.
Okay.
Testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Thank you.
Everybody ready? Okay, I'm Joanne Kavanaugh. I know most of you. After Mark's done with his remarks, I'm going to call on you one at a time to ask your question, just so we keep things orderly today. So, Mark, you could take it away.
Good afternoon, everybody. Well, nice to be with you this afternoon. Thanks for being here. Well, I think you know me by name already. Mark Sullivan, CEO of Catholic Health. This afternoon, I want to take some time and talk to you about
that we're in the 4th week of this strike. That's 26 days of the CWA taking our associates out on strike. Is 26 days without dedicated, compassionate, caring, experienced associates, as I said on October 1st, the soul of Mercy Hospital, not here. Is 26 days of our associates out on the picket line facing difficult economic challenges and hardships. Is 26 days of our system being forced to invest millions of dollars of our limited resources in replacement staff instead of investing in our people, our hospitals, and our community. It's 26 days of the CWA's strike causing delays in healthcare to patients in need, not only here at Mercy, not only locally, but as far down as the Pennsylvania border. We at Catholic Health, and I personally, want to welcome our associates back to this hospital. I want to be clear though, while the hospital continues to provide high quality care today with the temporary replacement workers, there is no replacement for the compassion, the experience, the long-time resources and associates we have at Mercy Hospital, and quite frankly, across our entire health system. Our community is ready. Our community needs Mercy Hospital to again be operating at its full capacity. But folks, it's important to know that Catholic Health cannot do that alone. As I said before, Catholic Health is working tirelessly to provide fair and competitive wages. But the ability to end the strike and end the hardships on the community and on the associates and on the region, the CWA has that ability working with us to end that strike. Now, despite this unusually difficult situation we are in, the hospital continues to put patient care first and do everything we can to serve the community. How do I know this? Because we walk the units. Our leaders are talking to associates on the floors. We hear firsthand from the associates the impact this strike is having not only on our system, but the patients that need access to care and our colleagues at ECMC and Kaleida Health. I want to share a few numbers with you so you can fully understand the impact this is having on our community. During the strike, Mercy has continued to care for approximately 100 patients, inpatients. In the building we're standing in today, there are over 100 patients. In fact, today there's 123 that we're caring for. It's about a third of the actual census of Mercy Hospital. In our emergency departments, we are seeing an average of 50 patients, which is half, or almost a third of the patients we typically see in our emergency departments. It's a fraction of the care we can provide at this hospital, which means others in the community needed to step up, or there's been long delays in care. You know, it's important that we focus on our associates, and our associates are concerned as well. A growing number of associates from Kenmore Mercy Hospital, Sisters of Charity Hospital, St. Joseph Campus, and Mercy Hospital are expressing a strong desire to settle the contract negotiations and for CWA to end the strike. They have a strong desire for the Mercy associates to get back to work, for the caring of the patients here at Mercy and in the community. And how do we know this? Because they're telling us this. We're receiving emails, text messages, and other ways that they're telling us that they want this to be over and they want to be back to work. But out of fear for backlash, they won't speak publicly. Our communities throughout Western New York are concerned. Hospitals in our county and the region, and as I said before, all the way down to Pennsylvania, are feeling the ripple effect and the impact on patient care. You know, I am also concerned not only about today, not only about tomorrow, but the long-term ramifications this strike will have on our system. That is my responsibility as the CEO of Catholic Health. Importantly to note, related to associates, since the strike began, over 50 nurses who are represented by CWA have resigned from Mercy Hospital, including more than a dozen from the ICU, or the intensive care unit. Now, the loss of critical staff is difficult during any situation, but can you imagine today, in the midst of a national health crisis, where with staffing shortages throughout our nation, is simply unthinkable. When Catholic Health and CWA are working daily to resolve known staffing challenges, this ongoing strike is further harming our ability to recruit the talent necessary here, the skilled associates, to meet those staffing needs here at Mercy Hospital. You know, skilled staffing members are core to our mission. and they've helped our hospitals repeatedly meet and exceed national standards for high quality and safety year after year after year. In the midst of the distractions caused by the strike, it's important for all of you watching and recording this and documenting this to remember that Catholic Health continues to receive high quality ratings and recognitions in the healthcare industry, thanks to the high quality care being provided in all of our sites. Our hospital is ranked one of the best regional hospitals by U.S. News and World Report, and has multiple star ratings related from the Centers of Medicare and Medicaid Services, or CMS. And Catholic Health has the region's most consecutive letter A grade scores by Leapfrog for patient safety. Some of the greatest scores in the state consecutively. Why do I share these rankings? It's not about the plaque on the wall. It's not about being on a list. It's because it demonstrates the high quality that our hospital here at Mercy Hospital and our health system have and dedicated to the safe, high quality care and the associates at the bedside. And it shows a transparency of what our real quality is. In fact, if there's an issue with quality, we've always encouraged our staff to come forward through the different channels we have to raise their hand if there's quality issues or safety issues, so we can continue to improve and strive for the excellence that I've just mentioned. We want to work with our associates side by side. We've done it through Snowvember. We've done it through the pandemic. It wasn't one group. It was working together. We want our associates back here at Mercy. We want to build on what we've established and continue to move forward. It's important to note that at the bargaining table, there's been questions about who's at the bargaining table. Our bargaining table has experts with over 30 years of experience, not in bargaining, but in healthcare. We have clinical leaders, we have operational leaders, we have imaging leaders, we have financial leaders, we have safety leaders, we have quality leaders. Any leader necessary to help work closely with CWA has been at that table to ensure that we have good communication and good outcomes for their members and our associates. Now, it's important to note during these conversations, the CWA has shared that our associates have priorities. Their members have priorities over the months of negotiations. And Catholic Health, as I stated before, has put forth a comprehensive market competitive package that increases wages and other contractual language that addresses all the associates' needs and their priorities. For example, this includes a minimum 3% wage increase in the first year, 2% in years 2 and 3, and 2.75% in year 4. And probably the biggest, most national challenge, our package includes a staffing model that will be the most progressive approach to address staffing shortages and staffing fluctuations in the region, if not in the state. Again, the most progressive staffing approach. Now, since the strike began, our focus has been to reach a fair and competitive agreement with our associates. And we do believe that the current offer on the table is a win for our associates. But I can't determine that. It should be put to a vote so that the associates can decide whether they want to accept the offer and the Mercy associates want to return to work and care for their patients. I want to also take a moment to address another issue that's out there about supplies. Despite the supply chain issues that affect every hospital, every business, every household, every car dealer, you name it in our country, there are supply shortages. We have been working around the clock and around the world to secure supplies for our associates so they can do their jobs. Our supply team has been here working relentlessly and throughout our facilities to accomplish that and rectify any challenges we have with supplies for our associates. So you may ask me, what happens now? Well, the CWA strike is in its 4th week. So Catholic Health must consider all options in the best interest of our patients, our associates, and the community. Now, you may not know this, but we made a commitment early on to continue health benefits for striking associates. And to date, we've spent more than $1.3 million providing health benefits to Mercy associates during the strike to ensure they had health insurance for themselves and their families. This was not legally required by Catholic Health. As we approach the 2nd month of the strike, our leadership team must consider whether to continue this coverage into November if the union continues the strike into November. It's important to do that because it's the reset of a new month. Unfortunately, we also have to explore opportunities for operational feasibility here at this campus. But we've heard from associates that want to get back to work. So our leadership team is also assessing the ability to allow associates to cross the picket line those that want to come back to work, those that prefer to work, those that have financial hardship, so they can continue caring to see patients again. Many associates have shared that with us directly, and so we're exploring that opportunity. We stand here at Mercy, we stand here at Kenmore Mercy, St. Joseph Campus of Sisters, ready to welcome associates back. They're our associates. We want them to be back here working. As I said 26 days ago in the Memorial Garden, that the soul of Mercy Hospital is outside picketing. We want the soul of Mercy Hospital back here. There is no replacement for their experience, their expertise, and the care they provide to our patients. They are the heart and soul of Mercy. We call on CWA today to end the strike and settle these negotiations. We have been working tirelessly with them to reach an agreement that's fair for all. Let us put a new tentative agreement together before our associates so they can see the facts for themselves outside the media and make an informed decision with their families. Is this something or an opportunity that wants them to come back to work? And is this offer fair? Is it competitive in the market? Does it help my family advance? We are ready to start the healing process. Our teams are ready to start the healing process and welcome the associates back here to Mercy. We want to be here for our community like we've been here for over 170 years. Mercy needs to get back to capacity. The soul needs to return to this campus, and we need to continue to reveal the healing love of Jesus to all, which is our mission statement. So I thank you for your time today, and I will take a few questions.
Let's start with John Harris from the Buffalo News.
Hi, John.
Hi, how you doing?
I'm well, thank you.
I was gonna ask about the staffing ratio. I think the union over the weekend said they're looking for like a nurse to patient ratio of 1 to 4 in the medical surgical floors. So I don't know if you could say kind of where that's been and, you know, is 1 to 4 realistic for Catholic Health?
Sure. So the challenge with staffing ratios is just that, calling them staffing ratios. We've spent countless hours with all of our nursing leaders from around our system, John, in the room with CWA to make sure this is a contract for success around that. So we're very close on understanding what staffing grids or ratios would work to effectuate change. But to your question, if we were at 4 to 1, 1 to 1, the challenge is the staffing shortage. So it's twofold. It's agreeing on what the staffing grid should be that could fluctuate with patient acuity and the need on those floors, but it's also how do we make sure that we have the staff to accomplish those, and that's what we're focusing on. So we're very committed, we're very close on all those. I think there was a lot of, I wouldn't say misunderstanding, I think different perspectives as to what that meant, and I do feel when this is public, both the CWA and Catholic Health should be very proud of what they've created, not only for CWA and Catholic Health, but really for the state, because it really shows that ability to flex and move, and also recognizes how tirelessly our nursing bedside caregivers, our intermediate treatment aides, our respiratory therapists, dietary, everybody, we need to have that for all the areas. So we spent hours with them, and hats off to CWA, because I think what we have is pretty outstanding, and we need to evaluate what that means by each unit. And it can't be based on beds, it needs to be based on patients, because everything we do at Catholic Health centers on patients.
Olivia Dance from Fox News.
Hi, Olivia.
Hi. Yeah, I just wanted to ask, the union is saying that Catholic Health is giving $20,000 sign-on bonuses to employees and recruits at Sisters of Charity Hospital, which doesn't have a union, so I'm just asking if you could respond to that and also discuss how this is possible at a time like this.
Absolutely, great question. We are offering those signing bonuses at Sisters Hospital. We offered a similar opportunity here at Mercy. The union rejected it in the summer. We were trying to figure out a way to recruit. If you're on your Facebook, you Google, there's not a health system in the country that's not trying to implement some type of sign-on bonus. The reason it's implemented at Sisters is because we could move like that. We presented a similar, not at the table per se, but to the union to how could we increase recruitment. And one of those options was doing a sign-in bonus, but they rejected our I wouldn't say offer, but our idea of doing that here.
Liz Lewin from Channel 2.
Liz?
So, sorry about that. You mentioned the amount of resignations that some nurses have put in,
Yep.
also the fact that over a dozen of those are coming from the ICU. We're still in the middle of the pandemic, flu season approaching a couple weeks away. What are you doing differently to attract more nurses and more employees? You know, healthcare is essentially the life raft right now that we're all depending on, and the community and other surrounding hospitals are at their brink. So what are you doing as a system to attract more people?
Right, so just I'll speak to this year. This year, we have pulled out all the stops in recruitment. We've recruited over 1,200 people to Catholic Health this year and over 230 nurses. We have recruiters around the country We have agreements signed with recruitment organizations around the country too. But it's really important that the strike is hindering some of that, because who wants to come to an organization when they're on strike? So we're working towards that. We're looking at different ways of incentivizing, to Olivia's point, different people to come to Western New York and do that. We also have a national challenge related to traveling nursing, which is impacting all of healthcare. So I think the elected officials, the policymakers need to think of how do we incentivize people to come into communities. That's a challenge, but we are doing everything we possibly can. Again, 1,200 new hires since January, 230 nurses so far. We continue to add people because of the signing bonus. People are coming and joining us. So we are pulling on all the stops to ensure that we can bring talent here to Catholic Health.
Brendan Keeney from WGRZ Radio.
Yeah, the fact that Catholic Health called this press conference today kind of leads me to believe that you don't think a deal is particularly close. Is that a fair characterization?
No, I called this press conference here today because I want to make sure you had the facts. One of the things that's most important to us is people come to us at their most vulnerable time in their life, and they trust us for transparency. They trust us for taking care of their loved ones. And I wanted to come here personally as a CEO of Catholic Health and look the cameras in the eyes and share the facts as of right now.
Typically, in these kinds of negotiations, it doesn't, go to the media very often, or as often it has been throughout this strike. Does that indicate a lack of trust between the two sides?
No, I think it's a lack of perspectives and a lack of facts. For me, Catholic Health has a fair and competitive offer on the table. We have to remind people of that. We have to remind people of how the wages are fair and competitive, the benefits are fair and competitive, the staffing model is very progressive, all the things that unions asked for. And with the political circus that's been here, with all of our national politicians coming through here for the photo ops and local politicians, we want to make sure, just like the patients rely on us when they come here for care, the patients know, the community knows what we're about and the facts behind what we're presenting.
Jeff Bruzak from Channel 7.
You just said you don't feel, you're too far away from a deal. How close do you feel?
I said I was very close on an interview on September 30th, and we're standing here 26 days into a labor strike. Communication is good. I think CWA has good intent. Catholic Health has good intent. We're talking, we're working through it. It could be over yesterday. It could have been over September 30th. I can't speculate on that. I just know right now Catholic Health has fair and competitive wages, benefits on no concessions on the benefits that we mentioned before. We also know the staffing is progressive. We also, as I mentioned here, or you may see it in the presser, that we've actually added retro pay. So over $1 million in retro pay, because we were thinking about how are these associates going to even make ends meet. So we offered that up in a proposal yesterday. We want this over. We want Mercy to get back to the way it delivers care, and we feel that our offer on the table is great. It's a good offer. It's a win-win, but it's up to each individual member to decide that. So.
Mike Desmond from WGRZ.
Hey, Mike.
Yeah, I don't know who else was here Sunday afternoon, but if you listen to what the union said and what you're saying, you're in different worlds. I mean, they say the issue was staffing, you were offering pay, and, are you guys actually sitting at the table and talking past each other?
No, every day they're talking. Let me say this. We've given you everything in writing that we have on the table. I've shared with you today the facts of what's on the table. I can't change what the union is saying. All I know is that we have a fair and competitive package on the table. You know what that is, almost more granular than people do. We do that because we want the community to be informed with the facts. We are working at the table. I don't know what they share during the press conferences. I know when I come here, you're looking at me as the CEO of Catholic Health to share the facts, to share what's on the table, and that's what my effort is for every one of our press conferences, including the one on October 1st at 6 in the morning. So what you have are the facts of what's on the table now. And it could change as I'm standing here, but I always do try in full transparency to provide the facts as to where we stand right now.
It sounds from what you're saying, this is an old-fashioned labor negotiation in some factory. You're going to take away their health insurance. You're going to let them cross the picket line. This is bargaining war.
You may call it that. I don't call it that. I'm pretty proud of what Catholic Health did for their associates to offer health insurance at a time when we are spending a ton of money on replacement workers. It's not a bargaining war. This can end today. It can end right now. The offer on the table, again, fair and competitive wages, compare it to anywhere else in the community. Fair benefits, the best staffing model, most progressive in the state. Those are the priorities that are mentioned in every press conference by CWA. Why is there not a deal yet? I can't answer that. Oh, come on, Corey.
Hi, Marley Tuscan
Hi,
from
Marley.
Channel 4.
Hi.
Hi, so when we heard from the union a couple weeks ago, they said that there were about 30 open items left on the table that you guys needed to come to agreement on. I'm wondering where that stands today, and I apologize if you had said that previously, we were having technical difficulties. But also, is this something that you considered when we were walking in, some of the picketers were calling on you to meet at the bargaining table? Have you thought about being there yourself?
Yeah, so it's important, that the first question, what was the first question again?
How many items are still
Yeah, so
on?
a handful now. So the CWA, and again, hats off to them and Catholic Health, we spent a lot of time not talking past each other, understanding each other's perspectives and how they want people back to work, like we want people back to work. But there has to be a contract for success, or else we'll be here 4 years having the same press conference. And so that's what we're focusing on. As a CEO of a very large organization, I have an incredible team at the table. I talk to them 5 times a day, 24/7, well before the bargain started. When I was COO of Catholic Health, I was at the table or in another room. I'm in a different role. I have a whole health system to run with 5 nursing homes, 3 home care companies, 10,000 associates. My attention is on this and is very important, but the community needs me to be focused on multiple things. And we have the people at the table that are the experts, and I'm a phone call away if they need me.
One more? Yeah.
Yeah, sure.
Just a follow-up, what do you have to say to the Western New York community? I mean, there is another fear, and that reality is people think this isn't gonna end. Every day we're waking, you had a very compelling opening with day 26, and that's ringing in my head and a lot of people's heads, and the holidays are coming up, and people are scared, people are scared they won't be able to provide for their families, and they're scared they're not, their loved ones aren't gonna make it. So what do you have to say to the Western New York community, not CWA or us, but the people who we're all working for?
Right, so the first thing I would say is when this is all over, Catholic Health prides itself on never leaving a patient. And no matter what we invested in the last 26 days, we are caring for the patients in need. They couldn't walk out of the hospital, the patients. They're in their beds. So we are caring for the patients. So I want the community to realize that no matter what the circumstances are, just like when we were founded 170 years ago, we will be here for the patients. We prefer to have the soul of working. We prefer that. I'm sure the CWA would say the same. There's an opportunity to close this down right now and have a deal. And so the community needs to understand that we are committed to serving them. We could end up not even having a hospital open on October 1st and saved millions of dollars on my friends and colleagues at Collide and ECMC. That wouldn't have been the right thing to do. Patients, the community needs to be steadfast and take care of their own health and know that we're here for them. The circumstances that we're in are the hands we were dealt, but we're and we always will be. In that, I take more pride in than anything. The circumstances are, no matter what the burden. We will maintain high quality, transparent, we will be factual, and we'll serve the community, maybe not the capacity, but we will always be there for the community. Sure, Olivia? No problem.
So, you said that the union has the ability to end the strike. Over the weekend, there were probably the union is lacking in terms of urgency. Union the family emergency. So is Catholic Health worried that the way that they're approaching this will come across as lacking empathy?
Who's approaching it with lack of empathy?
Just with the press release.
Oh no, I will tell you this: is that we shared our condolences. We're all human beings first, Olivia. So we share our condolences, and it was an unfortunate loss for that Bart. We paused. We did whatever we needed to do to ensure that was recognized, because we're humans first. Catholic Health is in this business because we're human first. So that pause, although we bargained at the table, there was a restart on Friday. There is not a sense of urgency. If there was a sense of urgency, why are we in the 26th day if on October 12th I'm sharing with you we have a competitive package, we have competitive wages, we have competitive staffing, we have competitive benefits. So I think it's a matter of just the groups coming together and understanding what that means and both feeling like they've gotten what they need out of it. My comment is I can't stop the strike. I can't. I mean, you see in writing, as my friend from WBN pointed out, you have our proposal. It's very competitive and very compelling. If the members could vote on that, or the members could take that to their families and see if it's worth it, then maybe we would have a deal. So, yeah, I mean, we're humans first, and that, you need to realize that on both sides. And we would not be Catholic Health. That's what makes us unique, is our mission, vision, and values. And that was a terrible and unfortunate incident to be in, and we paused. We were still involved in bargaining, but we're humans first, so let's just make sure that's clear. But there is not the sense of urgency that we would want, because we have 50 people that have left, right? We're only a third of the capacity here. It's taxing the community, it's taxing the Pennsylvania hospitals. This should be over.
Thank you, everybody.
Okay.
We'll provide further updates as we get them.
And thanks, everybody, for coming out. Thank you.
Karen, this is the thing to be.
That was what we shared with our associates.
Oh.
Last week. So
Can I take it?
Yep. Okay. It's yours, Liz.
How are you?
I love the present. Did everybody get it?
I got one, thank you.
Thank you.
I was still trying to figure that out, but it depends on when it ends.
Well, it's so far.
So I don't want to just quote a number.
Right.
Just know it ends.
Yeah, it's really-
No, yes.